Hello, my name is Dr. Chris Chesky. I'm a trumpet player, and I'm chair of the Department of Performing Arts and Health at the Peabody Conservatory, and I'm a Bloomberg Distinguished Professor at the Johns Hopkins University. Tertiary music schools expect excellence, but at what cost? Hearing loss, musculoskeletal injuries, voice disorders, and mental health struggles are normalized as just part of the job. But they're not. In most cases, they're preventable. Occupational health in music is just as important as other core subjects. What good is mastering technique if your artistry is cut short by an injury that could have been avoided? The reality is that most musicians find themselves unprepared to protect their own occupational health and the health of the people they serve. Occupational health is not prioritized in most tertiary music schools. Across the discipline, only a few required courses exist on injury prevention. Furthermore, course instructors, studio faculty, ensemble conductors and directors, and leaders and school administrators receive little to no training on ensuring a healthy learning environment. Similarly, music students preparing for careers as music teachers are not sufficiently trained to incorporate these ideas into age-appropriate learning activities for children and young adults. With occupational health training, the very people responsible for shaping the next generation of musicians will be sufficiently equipped to prevent negative health outcomes directly associated with learning, performing, creating, and consuming music. Another concern is that musicians' bodies and minds require evidence-based treatment protocols designed to address the unique demands of their craft. While the number of clinicians providing targeted healthcare for musicians is increasing, we need to develop and strengthen the musicians' healthcare field by standardizing measures of clinical effectiveness. Healthcare providers must receive specialized training to treat music-related conditions with the expertise all musicians deserve. As a priority, music schools need to integrate occupational health into the core of the curriculum to enable an effective and sustainable response. Join us in advocating for positive cultural change on behalf of current and future musicians. It's time we value the occupational health of musicians as much as we value their craft. On July 9th, at the Johns Hopkins Bloomberg Center in Washington, D.C., we will call for such change. The first global summit on occupational health in music will bring together global experts, researchers, educators, musicians, and healthcare providers to advocate for tertiary music schools to own the responsibility for ensuring a safe learning environment and that occupational health is recognized as an essential area of knowledge and competency for all musicians.